All right.
All right, good afternoon. Thank you and welcome to our latest Economic Recovery and Revitalization Town Hall. I want to thank you for attending today. Today we have the County Executive, Mark Elrich, with us. We also have Garrett Glover from the Small Business Development Corporation, and we're going to give you a lot of good information. Unfortunately, all of it is not positive, but we're going to do our best to find some light in this darkness of the times that we're going through. So I thank you for listening today, and some housekeeping notes. I want to remind you, as you have questions, please feel free to put them in the chat as we go through our speakers and our information. We did receive a few questions early on that we are going to answer at the end of our session. So that'll begin that process, and then we'll answer the questions that are in the chat as we can and get to them within this hour. The first thing I want to say is that unfortunately we are not able to have Dr. Gales and Dr. Stoddard with us. They were pulled into a legal matter. I believe a lot of you recognize that this week we had a new executive order come out that was related to indoor dining, and they have been dealing with that legal matter for most of the day. So unfortunately, they will not be able to join us. We weren't going to discuss it per se with them, knowing that it's a legal matter and our team has advised against it, but we did want to address why they are not here. So the new executive order that came out this week, closed indoor dining, was the main thing that it did. It also put out the letter of approval possibility for our larger retail stores. And what that means is that for those larger retail stores who have employees that may hurt the limit of this particular executive order, we are now fielding and we want them to apply for letters of approval where our leadership team can go over and see if they actually will be able to have some flexibility in that so that they can run their business while we have rolled back this further restriction. I also want to note that the state has released information on a new financial relief package this year, this week. Governor Hogan announced $180 million of economic relief that will help family and small businesses that are hit and hurt hardest by the COVID pandemic. So please look for that in the near future as the county will take on administrating the role of that as it relates to our portion of that funding. There are still several active grant programs still being administered throughout the county. A couple of them are the medical and dental practice grants, the restaurant relief fund from the state that is being administered by EDC, thanks to them yet again, as well as the reopening grant program for Montgomery County. We are trying to get that money out the door as fast as possible. There's a lot of people working very hard and very long hours, and we want to thank them for the work that they're doing. So having said all that, now I do want to introduce our county executive, Mr. Mark Eric, and we'll turn it over to him in a few seconds. Thank you.
You guys have me?
We had you, Mr. County Executive. Thank you for joining us.
Thank you for inviting me to this discussion. I want to thank everybody who's attending here today. We continue to work to make sure people are informed about what we're doing and how we're moving forward through the pandemic. This is no fun for everybody, anybody, and everybody. And I just want to start by saying, we have unfortunately from the beginning been put in positions where we have to choose between impacts on human life and impacts on businesses. And had the federal government ever been serious about this, had they been willing to not only do closures and probably close everything in the beginning for maybe 6 weeks, but then backed up the businesses and the individuals who are going to lose the income, we probably wouldn't be where we're sitting now. Because the greatest anxiety everybody has about closures is the loss of work and the loss of a business and the loss of everything people took to build businesses. The federal government had a way to avoid that. They didn't do it. I still think it's not too late, and hopefully a different administration will take a different approach to support for businesses, but I've been advocating since March with the governor that they should be doing everything they can do to backstop the business sector and frankly residential rentals, so that either businesses or residents aren't facing evictions when the prohibitions on evictions end, and then when landlords come looking for 6 months back rent when you were closed, people don't make a decision that I'm not going to be able to pay that, so I'm going to fold instead. So I've advocated for greater state support. I'm supporting the efforts that the Comptroller Frantrot is doing right now to push the state to dip deeper into its reserves to provide more direct support to businesses. And I'll continue advocating at the federal level that once Biden comes into the presidency, the new administration takes very seriously the addressing of these problems, and that they bring money and that they put money forward to help support the business community. Like I said, this is not the business community's fault. And the fact that they're victims of the virus is just, another more evidence of just how widespread and damaging this virus has been. All that said, I implemented the new executive order this week, and we further limited the size number of people that can be in a space. And the big thing that's caused probably the most consternation, though not the only consternation, was the limitation on restaurants and to basically close indoor dining. And as COVID numbers continue to rise, we continue to be concerned about hospital capacity. And capacity limits are for everyone, including large retail stores. We are allowing the large retail stores to tell us what they're going to do if they want to exceed the 150, and if they have a plan that people think is feasible and reasonable, then we will be looking at it. But we're doing everything we can to make sure that people stay safe at the end of the day. We've been asked about, what were we looking at when we made this decision? And I guess I'll say that, a few weeks ago, before we actually did our last initiative, before this one, county executives in the state met with the advisors from Johns Hopkins. And the advisors from Johns Hopkins actually are also the governor's advisors. And what they told us was very chilling. They were very concerned about state hospital capacity. They're very concerned about the surge. And they pointed out what all of us know is, if these were the conditions that existed, or when these were the conditions that existed back in the spring, we closed everything. We are now open at a far greater level of openness than we were when we were being hit with all of the effects of the virus back during the spring. So we've gone a long way from the protective measures we took. And the governor in the beginning, I thought, did a very courageous thing, and that was he actually took action earlier than many governors did, and pretty much earlier than any Republican governor did. And Maryland's rise tapered off, flattened out, and began to decline. And so if you were looking at a chart of Maryland compared to the rest of the states, you'll see us starting to take off as many other states did, and then you'll see a halt in Maryland, and then this leveling period. And the leveling period lasts until about September. The problem was the virus didn't go away. We were able to contain it better, but we weren't able to make it go away. And in Montgomery County for a while, we were persisting at 45 to 60 cases a day and a positivity rate of around 3%. And I was concerned, and our health officers were concerned, that after day of 55 and 60 cases, they never stopped, which meant there were always people out in the community who were infecting other people. And this was our greatest concern, that we weren't able to really turn the corner and bury the virus. And there are lots of reasons for it, and probably big part of it was the decision that construction work was essential work. And so we had an enormous part of the workforce still going to work. And unfortunately, a lot of that workforce are people who don't have unemployment because they're not documented, don't have insurance, and cannot afford to take a day off from work. We call them essential workers. We really treat them like disposable workers. And so these people kept come to work every day, whether they're sick or not, until they're too sick to come to work. And it probably contributed to community spread. We know that the hospitals were another point of community spread, but when they do contact tracing, restaurants and retail comes back as other leading causes of community spread. So those were the things we were looking at that had concerned us. And I'm going to try to find, I have something I had up earlier, and I don't think I can import it into here because I'm not that good at importing things. But I wanted to highlight some of the things that we were told. Let's see. So there was, I'm getting there, bear with me. Every time you do something, your pages jump around. Okay, this is from Johns Hopkins University, and it was a report that was given on the 5th of December. And they're looking at Maryland and where people get in Maryland. And they say that of people responding to contact tracing, 28% who had visited a high-risk location had dined in an indoor restaurant or bar. And including outdoor dining, there was 41% of the people who had visited high-risk locations had actually dined. They looked at a study that was done in Hong Kong, and they found that bars and restaurants had an outsized effect on the spread of coronavirus, because it's a combination of the workers coming in and then going back to the communities, but also many different customers coming in and going back to many different communities that led to this having an outsized effect on the virus. When they looked at the baseline data, and they did an assumption that restaurants would stay at 50% of capacity, and there are no further interventions. They said the total beds needed for COVID in the average scenario would be about 9,000 beds, and in the worst case scenarios would surpass 10,000 beds, which would mean that most of the beds in the state of Maryland would be needed to COVID. And in one of our calls, one of the governor's people said, in order to accommodate COVID patients, they might have to go as low as 15% of the patients being in a hospital for something other than COVID. In other words, they would empty out the hospitals to make room for COVID patients. Hopkins then looked at the different assumptions about where cases come from, and they said that closing bars and restaurants in the state could possibly reduce hospital occupancy by 30%. So if you want to understand how we wound up on restaurants, the number one source was healthcare workers. It makes total sense that they're the most people getting sick, but you're not going to shut down healthcare work. So these people are going to be on the front lines and doing it. The second, was in the construction industries and and forms of work that were deemed essential, which were also not going to be shut down by the governor. And then there was dining. It was number 3, but it was, and I think indoor dining was number 4. Montgomery County only went as far as number 3. But closing those bars and restaurants in the state's mind, or in Hopkins' mind, would result in a lower number of cases. I will also say that our advisors were the governor's advisors. And this is part of the reason they came to the county executives, is it's not like they were sharing with us anything they hadn't shared with the state. And the state knew everything that we knew at that point, and we knew everything the state knew. So we were very concerned about it. They have another slide, and they said that if we had done a moderate closure, if we had gone back to phase 2, that would have been marginally more effective than just closing bars and restaurants. So just going back to phase 2 would have been a little bit better, but the governor had no appetite for going back to phase 2. So bars and restaurants are the next most effective thing we could do. And a high closure, which would be similar to going back to phase one, actually would have been significantly more effective. It would reduce the cases by potentially 50% or more. And a stay-at-home closure, of course, would have been the most effective, but it would have been the most severe impact on everybody and everything. So I have, from the beginning, taking my advice and direction from the county health officer, but also the information that's passed on to us from the state health officers. I don't believe political people should be making these decisions based on political preference. I think these ought to be decisions that are derived out of the health departments for the good of everybody. I'm not a doctor. I don't play one on TV, and I don't try to play one as county executive. So if our health officials are telling us we need to be careful, then my inclination is to be careful. And I will say that, we know what works. So we know that what the governor did in the face of this wave actually worked. And so now we've got a wave where our cases per 100,000 in Montgomery County are almost twice what they were at the peak of the pandemic earlier this year. And my positivity rate at cases per 100,000 at 45 cases per 100,000 is 6 or 7 times higher than it was in August and September, and is higher than it was earlier in the year. So we have the worst numbers right now that we've had all year. At one point, we were looking at positivity of around 3% in the county, and we were getting 5 cases per 100,000, which is 55 cases a day. Some days we were getting as low as 4 cases per 100,000. So when you're going from 4 and 5 cases per 100,000 to 45 cases per 100,000, you are not in a good place. And like I said, those numbers are much higher than they were in the spring. So if you want to know why I made the decision I made, that's why I made the decision I made. I thought it was in the best interest of the health of people in the county. I understand the pain this causes, folks in the business community, but the threat of these cases, the threat of the virus overwhelming the hospitals, the fact that our death rates are rising, all that contributed to getting us where we got. So what are the next steps for survival out of this economic situation? Well, first is I'm going to continue to champion greater relief out of the state and federal government, because they are frankly in a position to fix this. And they need to act like we're at war. And I'm not old enough to remember the Marshall Plan, because I was probably only 4 or 5 years old at the end of it. But I read about it because I was a history major. And, we rebuilt Europe after the calamity that destroyed Europe that was called World War II. And we need a Marshall Plan for American businesses. We need to make sure that people can reopen. We know people want to work. We know businesses want to reopen. The biggest impediment to reopening is going to be the debt that one carries from when their doors are closed. And for individuals, it's the inability to pay rent when you don't have income. And that especially affects our undocumented people. We need the federal government to step in for everybody. Everybody, all these folks went to work and contributed everything they could to keeping this place running, and we need to take care of them. So I'm going to continue to advocate for that. The state's announced a new $180 million financial package, which local governments are going to distribute. There's $50 million in there for hospitality, hotels. There's 25 or 30, I forget which. I think it's closer to 30 for restaurants. The county share of that restaurant money is about $5 million, a little north of $5 million. We'll be working to turn that around as quickly as possible. We'll develop our own plan post January 1 as we look at what we're going to do with new money that may come from the federal government on the current plan, as well as we may get an extension and not be required to spend all our CARES money by the end of December, depending what gets through Congress, assuming they get their act together. But we will look at continuing to contribute more county resources to direct aid to businesses and direct aid to individuals, particularly in the form of rent payments. And in case you're curious, we've done individual support, but we've also, in the case of rent payments, made the rent payments to landlords directly for tenants who are behind in their rents, because we don't want anybody getting money and being tempted to use it and then not having the money to pay the rent and then getting evicted anyway. So we are trying to target those payments directly toward landlords. And I would frankly hope that if there's federal relief for small businesses, particularly in the form of rent relief, that also goes directly toward the people who would be collecting the rent. I know there are some companies, some landlords in this county. I know the Learners have done some forbearance for their tenants, and I know that the Levens, because I've talked to people in Wheaton who really benefited from the Levens being willing to work with many of their tenants. Not all landlords have done that. I know landlords who've not been willing to do anything, so it's kind of a mixed bag out there. The county needs to decide what we're going to do with our reserves. We've got substantial reserves that were put aside for a rainy day. This does look like a rainy day. Actually, it looks like you're stuck in a continual tornado and the tornado is not going anywhere. So it's worse than a rainy day. We have to balance what we do with the ever-lurking rating agencies, and it really grieves me to get guidance that I shouldn't go too much into my reserve funds because it could cost us our AAA rating, when the whole point we've got reserve funds is to help people during a crisis like this. So we're trying to arrange a meeting with the bonding agencies to see if we can talk to them and what their expectations are for the county as we continue to go through this crisis. We're going to continue to work with the state. I'm encouraged, and I think this will not be the last package we see from the governor. The governor actually alluded to that in his comments when he opened up this package. So please stay tuned. I encourage everyone to have a stay safe holiday. I think the governor has banned all non-essential travel out of the state of Maryland or into the state of Maryland. Unless you're going to an adjoining county, an adjoining state, Pennsylvania, Delaware, and Virginia. Oddly enough, he missed West Virginia, so I'm pointing that out to them, that they might want to include West Virginia since they share a border too. But in general, I would just ask everyone, avoid gatherings, stay with your family, don't stay with anybody else, and don't take any unnecessary risks. We want as many people around to enjoy the recovery as possible. So don't do something today or in the next week or so that jeopardizes your ability to get through this. And with that, I'll stop.
Thank you. Thank you, County Executive. That was great information and great perspective. Even with the vaccine coming out this week and being distributed, I know that we got to make sure that we keep our eye on the longer term prize and not let our guard down with the holiday being right around the corner. So we know that the vaccine will go to those who need it first and foremost and not to the general public. So we all need to make sure we stay vigilant on ensuring that we follow the safety precautions. So thank you. That was great. We now want, Mr. Executive, if you have time to hang around for some question and answers later, yeah, that would be great. Sure. If not, we totally understand. Now we'll turn it over to our other guest speaker, Mr. Garrett Glover from the Small Business Development Corporation. So we would like to hear from him. He's going to give some guidance and some insight on, not only how to pivot during these times, but what business owners could and should be thinking about while they go through these terrible times. So I'll turn it over to Mr. Glover.
Yes, thank you. And County Executive, thank you very much for that very, very informative discourse on just how severe the situation is. Thank you for that. Very, very, very much needed, that kind of honesty and candor. Thank you. Just a background, if I may, how I'm coming to the pandemic. I am a restaurant retail industry specialist for the Maryland Small Business Center at the University of Maryland. And I was assigned to work the revitalization of Ellicott City when it was demolished by the 2014 flood. And I was there for 2.5 years working with the businesses to one, provide them relief, 2, procedures for recovery, and 3, economic revitalization, not just for the individual businesses, but for the destination. And I put in a program there that I call I call it my beer program, because the acronym is BIRE. And the reason I did that was because, if I go to these places and, I want to, if I want to put in this this economic revitalization program, say, which would you rather have, you guys? Would you rather have an economic revitalization program, or would you like me to bring in a beer program? And of course, everybody raises their hand. I'd rather have a beer program, right? So the acronym BIRE came out of that joke, that, sometimes economic revitalization intervention can sound, a bit tiresome, but everybody loves a glass of beer. So it's a beer program, and the acronym stands for Business Improvement, Retention, and Expansion. And if you can imagine me, I was called in the night of the flood, and showed up with other agencies and organizations early the next morning to take a look at the damage. And Ellicott City was annihilated, and we're talking about the historic district, annihilated. Floods wiped out all businesses, 90% of the businesses. So this is what I walked into, and I had to build a program. I had to build a program for the renovation of Old Ellicott City and the revitalization of Old Ellicott City. And, the government agencies, God bless them, did everything that they do, including calling in the SBDC. And but standing there that morning, looking down Old Main Street, it was dismal. I saw merchants out in front of the restaurants and retail shops and whatnot, on their knees, crying in front of the shops and things like that. It was really, really devastating. So I said the first thing that we got to do here is we've got to provide relief for these people. That is, give them the resources that they need, give them the psychological and emotional support that they need in order to find the motivation to come back. And the second phase was, once we had these resources, was to work these resources through a phase of recovery, and then recovery would lead to economic revitalization, which it did. 2.5 years later, we had Ellicott City back up on its feet, whereas most people said it would probably take 6 years. We didn't do it alone, obviously, with all the other agencies involved. But the beer program then became a model for disaster assistance in other areas, including I was then assigned to Middletown, Maryland, while I was still working in Ellicott City to do construction disruption intervention. And I took an adapted beer program up there. When the pandemic hit here, I was working and still do work the beer program in 4 or 5 communities throughout the state of Maryland. And when the pandemic hit, what I did was really kind of take the structure for the beer program and put that in place. And what I would like to do is, I'm listening to the county executive's report of how devastating this particular situation is. Reminded me of what we needed to do. Reminded me of what we did in Ellicott City to kind of inaugurate a recovery and a revitalization program, and that was to provide relief. And so what I would like to do, if I can, I will try to outline quickly, if I can, what we did in the Ellicott City disaster situation, and what we're doing now, parallels between the two, if I may. The first phase is, as I said, is really one of relief. Before I get into that, though, I agree with the county executive. The government has to do what they have to do. We can't do it for them. The businesses, we can't do that for them. The governments have to respond accordingly and appropriately and quickly. And that is up to them. We have minimal control over that. But what we do have control over is what we, the businesses, do and how we go about doing it. And so the first thing that I like to do in providing relief, and Jerome asked earlier, could you talk a little bit, how can businesses pivot their operations in response to this disaster? And the first thing that I recommend is that you respond to the crisis as opposed to react to it. You respond as opposed to react. That is, in response, be flexible and innovative with what you need to do, period. As opposed to a knee-jerk reaction and panic and depression and all that's expected in disasters. But that shouldn't become crippling. The disaster should not become crippling in that you react to it. You've got to respond to it. It is what it is, and I think that's the best way to look at it. And the first thing is that the first thing we do is to map out the options that you have available to you. With each set of with each disaster comes a set of options to be explored about how you can react. With one of the businesses in Ellicott City, I had a 2-hour conversation with her at one of the bookshops over there in Ellicott City, and we mapped out 13 different options that she had to look at. And I think that's the first thing. And included in that option was, I'm going to close my business. At the top of the list was, I want to stay in my business. But we went through 13 different options and we came up with an option. And this woman said, you know what, I'm going to stick it out and I'm going to make it work. And what that meant then was, what we had to do was to realign her business using a very methodical and deliberate strategic plan for relief. And so we did. So we have mapped out options. We came up with the option that we wanted to use. And in doing that, mapping out your options, you look at each option as though that is the best option that you can do. So we went through 13 best options. At the end of it all, we then reviewed what was most likely and what that business person really wanted to do. And we came up with it. I'm going to go for it. So that's the first thing I think we've really got to do here as businesses, and we're doing it in the beer program is doing this in the other areas, that we are mapping out our options and we are culling that list of options and we're choosing the best option that we can. And then as a result of that, we're coming up with a strategic growth plan for improvement. And that strategic growth plan is based on what that business is before the pandemic, as it was in Ellicott City. What is that business? That business supplies, or we think successful businesses supply or fulfill a need in a community. And that community can support that business in that need, or it may not. Those businesses that do succeed are supported in that community because that business contributes to the community in a way that business becomes a part of the community. That is one of the things that I'm really adamant about, is when you differentiate yourself as a business, you differentiate yourself, your business, so you can compete with your competitors, yes, but also so that you fulfill an irrefutable need in the community. And as a result of fulfilling that community need, you become an integral part of the community. So the first thing we do, the first thing that I really kind of advocate and work with the businesses on is this, is don't go out of sight, because if you go out of sight, you go out of mind. If you go out of sight, you go out of mind. That is it. You close down, you give up, you shorten your business, you shorten your commitment to community. What happens is your profile in that community is no longer relevant. And then and to me, that sounds like a very kind of theoretical approach to it. But if you think about it, that's really what it is all about. If you become an integral member of that community, the last thing on earth you want to do to sustain the business and to improve the business is to keep your profile up in that community, which means that you're going to have to do a strategic growth plan, put in a strategic growth plan that will enable you to continue to serve that community, fulfill that need, and as a result, be perceived as an integral element of that community. So stay relevant to survive. I mean, that's the real thing. Maintain your profile in the community throughout this whole thing. I mean, I do a lot of stuff, in my career. One of them was I was Clyde Restaurant Group's first corporate operations manager, and I was brought in at the time that they were to take them from 4 restaurants to 12 restaurants, which we did. I did in a 7-year period with them, from $49 million in sales to $129 million in sales. And I did that using Clyde's huge advantage over all the other restaurant businesses in DC, is that it was perceived as a Washington DC restaurant. It was perceived as a Washington DC saloon. It had and it fulfilled a great need in DC. What it did not do at that time, it didn't have kind of a real growth strategy for based on what it really was in the 4 restaurants that we had, and that was clients always a third place. And the third place is the third place where the community likes to go. First, there's home, there's business, maybe not always business, but the third place is, it's a place of comfort, it's a place for entertainment, it's a place for social activity, and that was a restaurant. That's one of the reasons Clyde's became so popular. And in growing that business, we based an infrastructure in Clyde's based on that principal idea that they are a third place. They are a place where the community wants to be and has a role in the community. That's how Clyde's had to stay relevant if it was going to proceed, and it did. So that's the first thing I think we've got to do, and these are things that I've actually done in Chestertown and Cambridge, up in Middletown as well, with businesses in this pandemic, is that those businesses that are there have been there, and we've got to make them stay relevant. How do we make them stay relevant? We come up with a strategic growth plan for them based on what they are and why they are successful and why they have succeeded in the past. That is their brand ID. And so we take this idea of the brand ID, not just a brand, right? You can have a gift shop, okay? And a gift shop is a brand. But in order to succeed, you have to do more. You have to, as a gift shop, you have to find a way to differentiate yourself. And that's done through product and through services. So we find out what that brand ID is, and we milk that and develop that brand ID. I mention that because the brand ID, what the brand ID does is it creates an emotional, cathartic relationship between the consumer and the business, so that when the consumer or the customer thinks about going out shopping for a particular item, there's an emotional attachment to that business and they go there. So that's the brand ID. So this idea of developing and managing your brand ID is really, really important to staying relevant in the community. If you don't develop a brand ID, you're just another brand, just another gift shop, you're going to go away. Coming up with a strategic growth plan, however, in dealing with your brand ID, the thing that's really important, and this is the thing that I've been pushing since Ellicott City with all the business I'm working with, you've got to diversify your revenue streams. What do I mean by that? What I mean is in one single shop, you've got to create multiple profit centers. And of course, with in Ellicott City, with your businesses wiped out, you know, we could do a number of things. We could relocate, right? That's how we could get around a disaster. We could diversify a particular business, take it to a different location. We can't do that in the pandemic because there is no location you relocate to and not be safe It's not going to happen. And this is what makes the recovery, the relief and the recovery phase in this pandemic so difficult, is that pandemic is universal. It is out there. You can't run away from it. Wherever you run to, it's there. So what do you do in your community? What do you do in the community that you're in? You're fulfilling a need for, and you are considered a third place. What you do is you start to diversify your revenue streams. And I'm going to give you an example of, if I may, of an Ellicott City business that I worked with, All Time Toys, which is you talk about a store in a niche industry. Nothing's more niche than that. Alternative pop culture toys. First thing we did was with this gentleman was to introduce different types to try and talk about options, find out what kind of options there were for increasing his business. Okay, so, and that meant creating new businesses within his single business. So first thing we did, obviously. So the first thing we went and we diversified our income, streams. We put in e-commerce, we put in collections, we put in collections and things like that. As a result of that, today, this gentleman survived the second flood. We relocated to Eldersburg. He's up in Eldersburg right now. We have him in a new places up there, a new location up there. He has 8 multiple streams in there. And he is doing better in the COVID now than he was doing previous to COVID, because where one profit center would fail, say for example the brick and mortar fails, or there's decrease in sales there, his e-commerce, we got him on eBay. He's covering those losses in the retail business plus some. So the first thing that I really kind of recommend for you for businesses, if we could get into this deeper if we wanted, is take a real hard look at other ways to leverage your core assets and create different revenue centers, so you have multiple revenue centers working for you. Now, and I have 30 seconds more on this, and that is this. The other thing that we've done in the intervention is we have taken advantage of every possible funding opportunity that we can find. Every single funding opportunity. Don't let anything slide by, whether it be the feds, whether it be the state, whether it be the county, or it be commercials. For example, Lowe's, for example, is doing these small micro grants and things like that for businesses. Take advantage of that. I have people in Chestertown who did, that's one thing we focused on. They got $275,000 in the bank by working these loans. So my advice to you is that the federal government and local state governments are going to do what they do and provide the same kind of funding that they provided in the first stimulus package. Take advantage of it, every single one of them. And that's about it. We could, I could go on and talk about other things, but I'm running out of time here. So But I wanted to give you the overview anyway.
No, that was great. Thank you, Mr. Glover. That was a lot of good information. I'm sure our viewers were engaged in it because it may have been a different perspective on what they were going through that they had not had looked at it at that angle. So thank you for sharing that, and thanks for that professional perspective. I think that it would help some people out for sure. And like you said, if we need to have an extended conversation, and hopefully you will want to come back and have you come back and engage the group again, that would be great. We do have a few questions. Like I said, we have a few submitted questions, but I'm going to ask this one question first that we got in the chat as it relates to the county executive and workforce development, which is something that is near and dear to him and one of his top priorities. It says, County Executive, thank you for your leadership on this one. One topic I have not seen addressed so far: closures, downsizing, produce disassembly of teams that would otherwise rebuild businesses. From another perspective, this can disrupt careers, resulting in increased chronic unemployment and loss of skills of our workforce. What can the county do to address this impending impact?
That is a stunningly complex question because my office does not come with a magic wand. I discovered that early on. Look, we're doubling down on workforce development and looking to make major changes. And hopefully the new director comes on board in January, right, Jerome? And
yes, sir, mid-January.
And hopefully a greater focus on, training, upskilling people, doing, we know that jobs are going to be different after COVID. And we're hoping that the director and the board are able to take directions that help produce a different and more flexible workforce. I'm also hoping that within the business community that there's an ability or willingness to bring on people whose maybe previous experiences aren't the perfect match today, but you don't have the perfect match and their jobs no longer match, or their skill levels no longer match. And so there's a role played by the private sector in helping develop and nurture employees as they seek to return. And I think the big thing is, I'll go back to what I said in the beginning, the more the government can do to deal with the rent issue, and probably if you're a restaurant, the equipment you bought that you've probably got payments on, because I know how expensive it is to equip a restaurant. If we could deal with the debt issues in ways that people were not afraid to reopen again, I think that would bring back a lot of things that we may assume have gone by the board. But that's really going to require willingness from the federal government, to some extent the state government, to step up to a degree they haven't done so far. There's no easy answer.
Jerome, that was a tough question to ask him.
I don't make up the questions. Why did you make up that one?
I was going to say, I train my staff well.
Right, that is a genuine question. And knowing that, how we work on retraining and retaining the talent pipeline here in the county is one of our most important efforts. Part of the Economic Advisory Group, and what that group has studied and worked on and will continue to work on, is how do we partner with our educational partners? How do we also make sure that we have the right programs, youth programs, all the programs that we need to help people who are going through this rebuilding process? It is going to take a great infrastructure. And some of you may remember that WorkSource Montgomery is the convener of the workforce development pieces that we envision it to be in the county. So we're going to be calling back on them to sort of jump back into that role. I think that will be critical as we go forward. I do want to share a couple of other questions. One question I want to share that we received was, can we share contact tracing data for Montgomery County that we relied on when we developed the executive order that became effective this week? Now, executive, Dr. Stoddard has some of that information in his speakings that he is dealing with at the legal issue that I talked about earlier, but not sure if you have anything on contact tracing you'd want to relay back to the audience on how we use it and how we believe that it's effective.
So I think when I tried to present the information that came from Hopkins, that was cumulative contact tracing at the state level. So this notion that restaurants ranked very high, indoor dining ranked very high among the things that were in common for people who had COVID is largely what we've relied on. I've got to say that, I think we were told this morning that the state has stopped collecting certain data.
That is correct.
So there's no better way, as Donald Trump has demonstrated, than demonstrating that there's no problem than getting rid of any data that indicates there's a problem. And the state apparently has tried that. When the governor made his statement, he said that, I don't know why you're doing indoor dining. It's number 5 on the list. Well, number 1 on the list was healthcare workers. Number 2 on the list was other. Number 3 on the list was, I think it was the construction folks, but it was, another trade thing. Number 4 on the list was another other, and number 5 on the list was restaurants. So restaurants got to be number 5 by including 2 categories that include multiple things, adding them together and putting them above restaurants. And so I've seen the same chart without the other, and the other would break down into smaller pieces and be farther down the line, where restaurants sit number 3. So I guess we're going to be more hamstrung by lack of information. And, the classic of this was when the governor opened Ocean City, and all of the contact tracing, there is not a single dab of information of how many people went to Ocean City last week. We know that the counties over there spiked enormously high numbers of cases during the summer. And to not use your contact tracing to say these many people were in Ocean City last week, I think was a major failure of the use of investigative tool. It might well have indicated that opening that much was not a really bright idea, and it might have given us a better tool or a better way of framing what we were doing as he continued to open more things in the state. So I try to use the data. Numbers I quoted you were straight off the Hopkins data sheet. Mm-hmm. It is what it is.
No, and that was very helpful. And one of the questions that we got in one of our work groups yesterday was, our doctors, Gales and Dr. Stoddard, we use the phrase of we're following the science, but we don't necessarily point to one particular document that is where we use to make our decision. And as I was speaking to them earlier, and again, sorry they couldn't be here, they wanted to just relay and point out that there are multiple areas where they get their information from to make the decisions that they use that guides their recommendations to you for the county. And we know that you have the utmost confidence in both of them based on the jobs that they have done so far to get us to this point in time during this pandemic.
So Kai, I just want to say, I think this has been tough for everybody. But when if you were to look at a chart of Montgomery County and the rest of the state, what you'll see by and large is among the big counties, we're either the lowest or the next lowest, even though we're the biggest county in the state, whether it's cases per 100,000 or whether it's positivity rate. We've been able to keep our rates lower. And in the state in general, we're lower than most counties in the state. And if Dr. Gales and Dr. Stoddard had not directed us to do what they did in this metropolitan area, we would not be where we are today. I believe that. Some people may not believe it, but I am convinced if we had not followed their direction, we would be in a far worse place than we are right now. And I feel like I owe them an enormous debt of gratitude, and I feel really bad for the kind of abuse that Travis has taken, where people, aren't content to disagree with him medically, but people with no medical background, insult him on basis of race and other things, and it's not right. And I hope people refrain from that.
Yeah, I couldn't agree with you more. I think sometimes there's just a target out there for people who want to have a face to put to some of their anger, and it's not him, and it's not his fault. He's doing what he professionally has done and his experience reflects for years and years, and that's to keep people safe during this pandemic. So I do have one final question that I'm going to read, and I got an answer from Dr. Gales on it, so I'll give it to the group. The question was, we have seen the guidance on how the vaccine will be distributed. Determining those in the first phase is obvious. The next two tiers are a little bit more difficult to understand. Can Dr. Gales please define people at significantly higher risk of severe COVID illness and people at moderately higher risk of severe COVID illness? Is age a consideration in these definitions, and where do public-facing employees of restaurants and retail operations fit in? And the response from Dr. Gales was the state is providing guidance and further definition on the remaining two tiers. The Commission of Immunization Practices, who provides guidance on vaccine usage, has formally approved the definitions of the first tier. The remaining tiers are yet to be further defined, so those determinations are being made at a state and federal level. Please stay tuned for further details. So that is going to wrap up the questions that we received in advance. Let me see, we do have time. Let me see if we got time for one more question. One question is, can we get the contact information for you, Mr. Glover? So, Mr. Glover, are you able to put your contact information in the chat? Or Ellen, can you do that? I'll take silence as a yes right now. Well, we'll get that in the chat for you. Mr. Executive, I'm gonna get you out of here on this last question. It says the county executive advises that the federal and state governments need to step up and act like we're at war. The county has done much using federal money to try to help businesses, but wouldn't it be appropriate for the county to act like we're at war and delay spending on certain county programs that could wait until we are out of this? So it sounds more like a, are you making sure that you are prioritizing your spending as well as monitoring what money we get in from other areas? And this might be kind of timely, since I just saw an email today about us going through another savings plan in order to get us through the end of the calendar year. I know the county is tightening its belt up like everybody else is, but I'll stop and see if you have a more official response for this person.
I think, in general, people kind of overestimate the ability of the county to flex money around. I've got a $6 billion budget rounded off. It's more than that. Then you take off the school system, that's $3 billion that we have no control over. So I'm down to $3 billion. By the time you take off interest payments, health, benefits, retiree benefits, current benefits, all these other things, I'm down to about $1.3 billion. And by the time you take off earmarked money that comes from the federal government or the state that can only be used for certain programs and is not fungible, I'm down to about $940 million. And when you consider that the bulk of that money goes to police and fire, I'm down to even less. So I don't have much flexibility to prioritize. Our health and human services stuff is really low. We've given a lot of money out to people in order to keep them in their housing, in order to meet particularly groups that aren't eligible for federal benefits. That has put an enormous burden on us. Remember, we wind up with the healthcare tab, we wind up with food support, we wind up with everything everybody else in America gets, except for these people who are out here working every day and making sure that construction sites go on and who don't get those things. So we're doing what we can to prioritize. We're sending over a savings plan. We're looking at some pretty radical stuff that we're going to have to do. But anything we cut is going to reduce services to people. So I'm not like a business where, if I shrink, I provide, I sell fewer dinners, whatever. Most of what the government does is addresses human need. And when I start making these cuts in the budget, it's going to be addressing things the county residents think also address their human needs, and they will get less of it. And that's, a real dilemma for us, but we don't have any choice. That's what we're going to do.
All right, thank you very much. I think this puts us right at our ending time. You got one more? Yes, sir.
There's one quick thing. There's an issue in here that Brendan O'Leary had about electrical stuff, and I just can make sure that goes to the right people, because I'm inclined to agree with him.
I've already contacted Mitra from DPS and Rick, and they are already on it. I gave them the contact information. We are going to make sure someone reaches out to him as soon as possible. Just so everyone knows what he's talking about, the question was about the hard wiring and the DPS permit qualifications that are being stood up right now that are in his way of doing what he's trying to do, which is set up a temporary tent. We got to find a way to get around that. And that's a perfect example of us. Yeah, that's a perfect example of us needing to be more flexible in a situation where it calls for it to get this happen. So we understand Brendan's comments.
And the other thing I want to say is that we are not going to wait to go back to zero to reopen. I want to make that clear, because I realize some people think you've closed it. You're not going to reopen again until we get a reset all the way back to the beginning. I'm not going to wait to go back to the beginning. We had things open at, levels that were higher than the beginning. If we can bend this curve back, then we'll start opening things, and we're having conversations of what are the trigger points. The irony is we were discussing in August, what would the trigger points be for opening more things that the state had decided to open, and all that went out the window when the cases climbed. Instead, we began talking about what's the trigger point for closing. But now we've answered the trigger point for closing in not a happy way. So we will revisit the trigger point for opening. The school system has got a plan for opening, but again, the trigger point for it has pushed it back a little bit later than they want. And if you guys aren't, if you've all been engrossed by this discussion, you may have missed that Muriel Bowser closed indoor dining in DC within maybe an hour or so ago. But she also said, similar to what I said, that they will revisit this in January. And depending where these cases go, if we get them back down and they flatten out and we think that we're not going to trigger another spike, then we'll look at reopening as well. We don't want this to be permanent or any longer than it needs to be to get cases down.
Okay, I think that's a perfect place to end. I want to thank Mr. Glover. Thank you for coming and joining us. We appreciate the words of wisdom, and County Executive Belrick, it is always a pleasure. We appreciate your leadership as well. And to everyone out there watching and viewing, please continue to stay safe. Have a happy and safe holiday season, and just take care of one another. All right. Thank you.
Thank you.
Thank you.